So South Africa is joining the world in commemorating World AIDS Day. This day was set aside to highlight the scourge of HIV and AIDS. This year's main event will be held in the Northwest, where we find my colleague Lucas Mothibedi. Lucas, a very good morning to you.
Morning, Brain, and morning to the viewers.
So tell us, it should be a very busy morning, afternoon in the Northwest. We're dealing with an issue that has touched so many lives, not only in South Africa, but around the world. We know the stats. In South Africa, we're sitting at about 8 million people that are infected with HIV. What is the situation in your province?
In fact, right now we're here in just outside the Orkney, where there's a meeting between the Deputy President and, of course, some of the sectoral players. In fact, I'm just going to look over my shoulder here because the camera operator is showing me that, in fact, they are about to leave to visit the family of one of the AIDS activists here in Orkney. I will try to speak to the Deputy President. I'm sure we'll try to catch up to him because I see him there. But other than that, we understand that over 30.7 people are living with HIV, or rather are living with HIV globally. Of the number, 30% of them are here in South Africa. But here in the Northwest Province, we understand that the program will be starting just here. There was a briefing between the Deputy President, who's also the chairperson of the AIDS Council, together with some of the strategic partners in the health sector, including some of the health workers and other role players. From here, they will be visiting a family in Orkney where engagement will continue. We're expecting that they will be briefing the media and understand that the program will be starting shortly after 11 o'clock at the local stadium.
So, Lucas, I understand that a community health center will also be opened. How important is this health center?
Today there are festivities, in fact, that are from the health center that will be opening today. We also understand that the AIDS Council, which has not been here in the Northwest for the past 5 years, will be relaunched in the Northwest Province, which is something that has been lauded by some of the most community members, including some of the AIDS activists that are here. So we are expecting that. We'll be talking to the MEC. He was saying today that there's an issue with the provision of condoms. In fact, condoms, about 5 million condoms are distributed in the province, but the number is quite low when you look at the usage of condoms in the Northwest Province, but which, of course, not just here, countrywide, given that the scourge, in fact, is somehow increasing from 7 million people that we know were HIV positive last year. Today, we know that that number is increased to 8 million, which is the number that is of people that are now on antiretroviral program. But they are saying that in terms of new infections, the number is somehow dwindling, given that last year it was over 300 people that were infected, but this year the number is somehow dwindled to about 250,000 people that are now HIV positive. So they are saying that progress are being made, strides are being made to try to control the widespread of the disease. We know that South Africa right now is the highest when it comes to the global community, with a population of people that are HIV positive, with about 8 million people that are now positive, which is the number that the Deputy President were expecting. What are measures on how to solve, or rather resolve and fight the widespread.
You mentioned, Lucas, that the Provincial AIDS Council will be relaunched. Do we know the reasons for the absence of this AIDS Council in that province?
Well, I missed the question, Bain, but I understand that from the provincial statement. Where we are now is Dr. Kenneth Kaunda region. One of the flashpoints, we understand that close to 100,000 people are now living with the HIV virus, and we understand that that number has increased when you look at the new infections at about 4,000 people annually here in the region. We spoke to the MEC earlier, Madoda Sambata, who was saying that although the scourge is really increasing, they have measures including the distribution of condoms, which of course it appears not being enough when you look at how the public awareness, because you can distribute condoms, but when you look at, given that the province is a predominantly rural area, when you look at the areas in the far flanks where that's where the problem is, people are not really using preventative measures to try to stay safe from the new infections.
Look, the condom use is one issue. What about stigma in your province, Lucas? I mean, you know, a young woman who finds out that she's pregnant, goes to a clinic, find out that she's HIV positive, and because of stigma, not returning to get onto some sort of treatment. Tell us about the issue of stigma in your province.
Well, Ben, as you can imagine, this is a rural province. The stigma is always here. But before that, there are successes. I mean, they were talking about 87% of the people, women that are now in antiretroviral program treatment. About 50,000 new infections have been thwarted, given that the program, the baby-to-child infections has now been thwarted here in the Northwest Province. But the stigma, when you go to areas like the far-flung areas like Taung, which is in the Ruth Mompati, here's the problem that you find. People are still not able to go to the hospital. Some of them, in fact, are not even knowing their statuses. Remember that we are talking about 90,000 people who are living with HIV positive know their statuses here in the country. But the problem is the 10%, those that have the disease, those that have a virus, but still do not know their statuses, because some of them, like you say, the stigma is here. We find that you want to go to test, but really they're not coming forward.
Cheka Mpilo is the buzz phrase, I guess, for this AIDS Day, World AIDS Day. Lucas Mothibedi, thank you very much indeed, sir, for your reporting. We'll try to catch up with you a little